So let's talk about anesthesia options with facial cosmetic surgery. So I have years of experience doing almost all procedures under local anesthesia with sedation. By sedation, what we do is we prescribe oral medications such as Ativan, Xanax, Valium, those type of medications for the patient to bring to the procedure. And based on their age, weight, anxiety level, blood pressure, number of factors, we will give a starting dose of those medications. And while the medications are taking effect, we're usually marking, measuring, and reviewing the procedure with the patient. And after that, about a half an hour of time, usually we'll give another additional medication in the form of an intramuscular injection of Versed. And that will usually put the patient into a state where they're very relaxed, and then we're able to perform the local anesthesia, injecting the numbing solution under the areas that we're going to work on and numb up those areas. And if the patient during the procedure starts to become a little bit more awake over time, we can always supplement with another intramuscular injection. And usually within about 5 minutes or so, we get them back into a state where they're very relaxed and comfortable again. So this works really well for many of our patients. Patients are surprised that we can accomplish so many procedures with this. We are able to perform a face and neck lift. We're able to perform sometimes eyelids with it, or other enhancement procedures, brow lifts, lip lifts. We've done this on thousands of patients, and patients do very well with it. People are different, though, in terms of how well these medications work for them, so we do have to titrate throughout the procedure. Also, they are awake and they are reactive, although they may not remember it. So we do put music on in the background. Part of the whole technique is to not have a lot of conversation in the operating room. That's a stimulation for them. We let them just close their eyes, relax, and listen to the music. And a lot of times they don't have any sense of time when you do that. They think that they remember certain parts of it. They think they remember everything, but they only really remember what they remember. And the time seems to go by pretty quickly for them. So if they are feeling any kind of discomfort, they can also let me know. Also, one of the benefits for me as a surgeon is they have muscle tone in their neck and face, and they're able to move into different positions, which can be helpful for me to see what we're accomplishing. In fact, they can even hold their head in a position that frees up my hands and my technician's hands so that we can do other things during the procedure. So I find it actually helpful after doing it for many, many years. I find it to be actually a preferred way of doing it. Now, every now and then we have patients that are just maybe very anxious and don't feel that that's for them. And I don't want them to be overly stressed to where they have a bad experience. So if that's the case, we can do IV sedation. At this point, though, we have to have an anesthesiologist involved. So we would schedule their surgery ahead of time with an anesthesiologist, and they would give them medication through the IV. Now, those medications are more powerful. They can act very quickly, and you can, sometimes give patients into a deeper sleep than what you really want them to be in. And if they're not going to be able to breathe on their own, then you would definitely have to have an anesthesiologist there to monitor that and make sure that they are adequately breathing and watch their vital signs. Either way, we're always monitoring their vital signs, even with the local anesthesia with sedation. We have patients on cardiac monitors, we have pulse oximetry, we have blood pressure monitors. We also have sequential stockings on their legs for safety too, to help prevent blood clots. And obviously the deeper sleep they are, if they're moving less, there's maybe a little bit more risk theoretically of having a blood clot, although I've not seen that in my practice. But we want everything to be as safe as possible. We want the patient to have a good experience. And of course, the result is ultimately why they're there. But those are very important things. Now, if the procedure is going to go longer than perhaps 3 or 4 hours, sometimes, even though they're not feeling what I'm doing, they get uncomfortable on their back, they start to get antsy, they start to move around, and that can make it difficult to work. So procedures that we anticipate are going to go longer than 3 to 4 hours, typically we may consider and advise them to do IV sedation or maybe even general anesthesia. So it just depends also on their health conditions and other factors, but we take all that into consideration. We do let the patient choose, though. If somebody, even if they're doing a procedure that's only a couple hours long or less, and they just don't feel like that it's for them to be awake, they can also have IV sedation. So we have a lot of different options. I hope you've enjoyed this video. If you have any more questions or you want to make an appointment for a consultation, please feel free to contact us at newportfaces.com. Call us or text us at 949-566-1032.